apart from the chair, obviously.
Okay, Paulina, we should be live on YouTube.
Thank you, Dan. Chairman, if you'd like to start the meeting.
Thank you very much, Paulina. Good afternoon, everybody, and welcome to the, sorry, I've got to continue. Sorry, good afternoon, everybody. Welcome to the joint meeting of the Scrutiny Committees. I would like to start by welcoming those members of the public and press who are watching this live stream of this meeting through the Council's YouTube page. Due to government guidance on social distancing, this meeting is taking place remotely in accordance with current legislation as laid out in the local authorities, police and crime panels, coronavirus, flexibility of local authority and police and crime panels, England and Wales, regulations 2020, which make provision for remote attendance at and remote access to council meetings. The meeting is also following the Peterborough City Council's virtual meeting protocol. In order for this meeting to run smoothly, there are several things of members and participants. Firstly, that you keep your video camera switched on with your microphone muted except when you're invited to speak. If you wish to speak, then please raise the virtual hand, which is the blue hand and is located at the bottom of the participants section. I and the Democratic Services team will keep an eye out on the participants list to see who wishes to speak. Please be patient if you're not invited to speak as soon as you have raised your hand. There may be many people wishing to speak before you. The Democratic Services team will be monitoring the participants list to see if anybody drops out of the meeting and will try and contact you to provide assistance to rejoin if this should happen. As with all new systems, we may run into technical problems, and for this I ask for your patience. Should this occur, an adjournment of the meeting will be declared while the fault is addressed, and the public broadcast will be paused. If this is not possible, the meeting will then be adjourned until such time as it can then be reconvened. Finally, I remind members that all virtual meetings are recorded. Before we move to the first item on the agenda, I will begin by taking a roll call of all scrutiny members to establish your presence. When your name is called out, please unmute your microphone and confirm that you're in attendance. Thank you. Paulina, could you take the roll call, please?
Thank you, Chair. So I'll start by reading out the councillors' names in alphabetical order. Councillor Aiken.
Here.
Councillor Bisbee.
Present.
Councillor Sandra Bond.
Here.
Councillor Brown.
Present.
Councillor Burbidge.
Yeah, I'm here.
Councillor Casey.
Present.
Councillor Coles.
Present, Paulina.
Councillor Day.
Present.
Councillor Dowson. I'm not sure if we've got him connected yet. Could anybody confirm, please?
No, he's not in the meeting yet.
Okay, thank you. Councillor Ellis.
Present.
Councillor John Fox.
Yep.
Councillor Judy Fox.
I'm here.
Councillor Harper, obviously.
I'm here.
Councillor Haynes.
Present.
Councillor Hemraj.
Yeah.
Councillor Howard.
I'm here.
Councillor Howell.
Present.
I'm not sure if Councillor Jamil has joined us yet. Can the team confirm?
Present.
Thank you, Councillor Jamil. Councillor Jones.
Here.
Councillor Joseph.
Present.
Councillor Lane.
Present.
Councillor Over.
Present.
Councillor Kyan.
Thank you, Paulina. Present.
Councillor Robinson.
Yes, present.
Councillor Rush.
Present.
Councillor Sanford.
Here, but apologies, I shall have to leave the meeting at 5:30.
Thank you, Councillor Sanford. Councillor Simons.
Present.
Councillor Skibstead.
Present.
Councillor Warren.
Present.
Councillor Wigan.
Present.
Councillor Yazeen.
Present. Thank you, Paulina.
Thank you. I'll now go to the co-opted members. Keith Leavesley,
Present.
Neil Boyce,
Present.
Susie Lucas,
Present.
Junaid Batty,
Present.
June Ball,
In attendance.
and Rizwan Rahmatullah.
Present.
Thank you. That's everybody present and correct, Chairman.
Thank you very much, Paulina. For the benefit of those watching the meeting on YouTube, I will now confirm which officers are also present at the meeting. The foreign officers are also in attendance to ask any questions relating to the report. Gillian Beasley, the Chief Executive. Charlotte Black, Service Director, Adults and Safeguarding. Will Patton, Service Director, Commissioning. Lou Williams, Service Director, Children and Safeguarding. Jonathan Lewis, Service Director, Education. Adrian Chapman, Service Director for Communities and Partnerships. Dr. Liz Robin, Director for Public Health. Steve Cox, Executive Director, Place and Economy. Mohammed Hussain, Director, Housing Needs and Supply. Graham Hughes, Service Director, Highways and Transport. Sue Grace, Director, Customer and Digital Services. Amanda Askham, Director of Business Improvement and Development. Peter Carpenter, Acting Corporate Director, Resources. Fiona Macmillan, Director of Law and Governance. Also in attendance is the Leader, Councillor John Holditch, and all Cabinet members. I will now move on to item 1 on the agenda. Paulina, are there any apologies, please?
Thank you, Chairman. Yes, I've received apologies from Councillor Barkham, Councillor Goodwin and Councillor Ali. Councillor Joseph is in attendance as substitute for Councillor Ali. I've also received apologies from the following co-opted members: Alistair Kingsley and the following education co-opted members: Peter Cantley, Flavio Bites and Claire Watchorn. Thank you.
Thank you, Paulina. Agenda item 2 then. Do any members of the committee have any declarations of interest or whipping declarations? Councillor Bull, your hand's raised.
I'm a Vivacity trustee, so I won't be taking part in that section at all.
Thank you, Parish Councillor June Bull. Anybody else? No, thank you very much. Agenda item 3 is public questions. I understand we have received one question from Mr. Ahmed, which will be read out and responded to by Mohammed Hussain, Director of Housing Needs and Supply. Mr. Hussain, would you like to speak now?
Hello, thank you. Sorry, I was just taking myself off mute. Let me read out the question, which is, this is regarding North Ward, Peterborough. Would the council allow for overcrowding in homes during COVID? Specific properties with rogue landlords and overcrowding have been reported to the council. No social distancing measures are taking place in the local park, which brackets Gladstone Park off Borges Boulevard, and the bushes and hedges have not been trimmed. A lot of antisocial behaviour is taking place, but when issues are reported, the council uses COVID as a reason for not being able to take any action. As the health and safety of many residents is at risk, I believe the council should look properly into any reported issues. And I'd like to respond to that as follows. The response is a composite response, partly from my service and partly from the Peterborough Enforcement Services and from the street cleansing services as well. So in regard to overcrowding, the government guidance when it came out around matters that the local authorities should take action on in terms of housing people were related to people that were rough sleeping. There was no guidance issued in respect of moving or transferring people that were in overcrowding or otherwise unsatisfactory conditions. Had that been the guidance, it would have been difficult for us to work on that basis, because the numbers that would have been involved would have been simply too many and it would have overwhelmed the service completely. So we have acted in accordance with the guidance in that respect and will continue to do so. In respect of the other matters, so I have a prepared response. All PCC shrubs are cut back once a year, once per year. They will have their annual cut following bird nesting season. However, we will still side back anything that could be obstructing a public highway. So at the moment, it's nesting season, so they wouldn't be cut at the moment in any case. We will ask a member of Aragon Direct Services to check the location for any obstructions and have cut these back if required. And further, since the start of COVID, police officers are undertaking regular patrols in the area, which includes Gladstone Park. Any calls received by Peterborough City Council raising concerns around lack of social distancing are passed on to police colleagues. Residents are also encouraged to report incidents at the time they are taking place direct to the police. Officers from the Prevention and Enforcement Service will liaise with police around issues you have raised around tackling antisocial behaviour and look at options to promote social distancing messages in the park and in the wider community. And that's our response, and I hope that is satisfactory.
Thank you, Mr. Hussain. Okay, we'll now move on to agenda item 4, which is Peterborough City Council's response to COVID-19 recovery plan. This meeting is an opportunity for all members of each scrutiny committee to come together to scrutinise Peterborough City Council's response to the COVID-19 pandemic. You would have received an email with a link to the agenda and papers for this meeting, which provides you with all the covering report that also contains a link to access the individual service highlight reports. These were presented to Cabinet on the 22nd of June 2020. These are the reports we will be scrutinising today. Please can I remind members that when asking questions that you refer to the service area or relevant paragraph within the report to which your question relates, so that your question can be directed to the appropriate officer to respond. I would now like to ask Gillian Beasley to introduce the report.
Mr. Chairman, I put my hand up. I'd like to raise a point of order, please.
Yeah, could you wait until I call you in, because I was obviously in the middle there. So what is your point of order then, please, Mr. Nick?
Yeah, it's just I was anticipating, as is normal at council meetings, that we receive the we would actually receive the minutes of the previous meeting. Now, the previous meeting of this committee on the 20th of May, the minutes have been circulated. I've actually got a query on part of it, but I've just noticed that it doesn't actually appear on the agenda. Can you clarify why?
Thank you, Chair. I'll take that if you'd like. Yeah. Yes, Councillor Stanford, as with all the extraordinary meetings for the Joint Scrutiny Committee, the minutes of the meeting go to the next available committee. The minutes of the meeting will actually be going to the Health Committee next week. And we wouldn't normally discuss questions with regard to the minutes. Sorry, I didn't quite hear your second part of the question. Were you saying you've got some queries on the minutes? Sorry, I wasn't quite sure.
Yeah, I've got a question on the minutes of the meeting on the 20th of May. It's a slightly odd procedure where the minutes of a meeting of one committee could go to the next meeting of an entirely different committee. That's not the way things normally operate.
It usually is for joint scrutiny meetings, as they're extraordinary meetings. And obviously all the scrutiny committees are members of this one joint scrutiny committee. So you will see the minutes at the Health Scrutiny Committee next week. Okay.
Okay, good. Thanks, Paulina. Thanks for answering that. Thank you, Councillor. Okay, then I would refer back then to Gillian Beasley, please, to introduce your report.
Thank you very much, Chairman. And as members know, this is our second report to the Scrutiny Committee on this Council's response to COVID-19. And as you can see from the report, there are three things that we want to achieve today. First of all, we've set out the current response to the pandemic, and I think we're all clear that we are still in a response phase. So that's the first thing that the report covers. We're also covering progress made on our financial issues, service issues, and also community impact. Also, we set out the initial approach that we're taking to recovery. And you will find at your next meeting, joint meeting, that we'll set out those recovery issues in a lot more detail. But what this report endeavours to achieve is for you to understand that approach, how we're going to do impact assessments, but also the other elements that actually formulate the recovery process. And that's in paragraph 15.6 of your report today. You'll also have noticed that we've actually changed our highlight reports and we've made them more relevant to the current situation we're facing. In other words, what's happening in the here and now. We publish those fortnightly and they give you the detail that, if you like, sits behind the report that you're scrutinising today. So to the report itself, Chairman. In the first part of the report, we focus on test and trace. And after I finish speaking, I'm going to ask Dr. Liz Robin to update you on our local outbreak control plan. As many of you will know, we had to publish that plan on the 30th of June, and that was duly published on that date. And it's important that we update you on that part of, if you like, the test and trace and our responsibilities as Peterborough City Council. Liz will also cover off the situation with respect to COVID-19 as it stands in Peterborough today. So after I've spoken, I'm going to hand on to Liz to do that for you. You'll see the report also covers the work of a hub, and that hub was set up to support the vulnerable, the most vulnerable during the COVID-19 crisis. It also covers our work with care homes and how the money from government for infection control has been deployed to adult social care providers. But it also covers the new model of how we're going to support care homes going forward. There's a section on our reopening of schools and also reopening of the city centre. And as I said before, there's a detailed section on our approach to recovery, which you will see, as I say, in more detail at your next meeting. There's a section on Vivacity, and that describes the review work that we're doing in relation to Vivacity and how we're looking at the future delivery of services effectively for our residents, either by the council or in partnership with others. And finally, you have a financial section because, of course, finances are extremely important in relation to COVID-19, and that's also covered in the report for you to scrutinise today. So, Chairman, that gives you an overview of the content of this report, and I'd like, if I can, to hand over to Dr. Liz Robin to provide an update, as I said, on our outbreak control plan, but also on the current Peterborough situation with respect to COVID-19. Thank you, Chairman.
Thank you, Gillian Beasley. Straight over then to Dr. Robin then, please.
Okay, thank you. So as Gillian said, National Government announced on the 24th of May that all upper tier councils in England were required to produce a local outbreak control plan. This is our local contribution, working with the National Test and Trace System and with multi-agency partner organisations to contain COVID-19, which is still circulating in our communities throughout England and indeed the world, and to prevent a second wave of infection. Our local outbreak plan places a strong focus on the measures we can all take to prevent the spread of COVID-19, including social distancing, regular hand washing, self-isolating and booking a test if you have symptoms of coronavirus. The plan also describes how we are improving our surveillance and monitoring of the local situation with daily meetings of a surveillance group to review national, regional and local COVID-19 data. And that information is then passed on to an outbreak management team to translate anything which the data shows us into relevant local actions. So the plan describes how we will identify and manage local outbreaks in care homes, schools, workplaces, or among other vulnerable population groups, and how we will make sure that testing is readily available with results turned around quickly. The plan outlines the governance structures and workforce requirements needed to implement it. These include a health protection board of senior officers, which is multi-agency, and a member-led local outbreak engagement board. A test and trace grant of approximately £1 million has been provided to Peterborough City Council to deliver our local outbreak plan. And now the plan is published on our website, we are absolutely focused on delivery and making this work. It's extremely important. COVID-19 has not gone away, and we need to do everything in order to ensure that we protect and care for our local communities. I'd now like to update you on the latest position on tests, cases and trends. So the first thing to say is that in Peterborough, we have seen a downward trend in cases. Local lockdown worked, and a downward trend in hospital admissions and deaths. Today, although I'm not sure that it's come out yet, we are expecting to see more information nationally on a set of test results that has not been published routinely on the daily dashboards before. And I'll explain this a little bit more. The cases that have been published on our daily dashboard, which is released by Public Health England at national level, but describes the number of cases in each local authority, has been based on tests that are run in local laboratories. So mainly patients in hospitals and people in care homes. It's been very much focused on people who are quite ill with COVID-19 and are in the health or care sector. And those are the figures that have been released nationally, and those are the figures that we have published in our local reports, because they are seen as reliable, and we're able to compare different areas of the country and local authorities. There is another set of tests which have been done, which are run in large national laboratories, and those are the tests which individuals book for themselves. So if you go to the drive-through testing site at Peterborough Showground, those tests don't go to local laboratories, those will go to the national labs. And the people who have these tests, which are called Pillar 2 tests, are members of the community who have symptoms. And also some care homes who order tests for everyone in the care home, residents and staff, without anyone necessarily having symptoms. It's a sort of screening tool. So these tests in the past have been published in the national figures, but have never been broken down to local authority level. And what you'll see in Peterborough is that we have quite, whereas on the Pillar 1 tests, we are below the national average on the number of cases that we see. And remember, those Pillar 1 cases are the most seriously ill who go into hospital or are in care homes and very sick in care homes. We remain in the same position on Pillar 1, but we have quite a lot of Pillar 2 cases. So we are above the national average for Pillar 2 cases. And I wanted to explain that to you because it will seem quite strange when you see the data that Peterborough has been well below national average. It's been around the regional average for all the case information presented so far. But now that Public Health England is confident enough in the Pillar 2 case data, that will be published, and that will bring Peterborough up the rankings in terms of number of cases. So our levels of Pillar 2 are higher than average, and that will be a change. On the whole, those cases are people who are less seriously ill, so they're people who are perhaps younger, who are out there in the community, who don't get as ill and therefore go to the drive-through or order a test at home. So you'll see that information, and we have acted on it. We recognise this means that there are cases in Peterborough in the community, as there are everywhere. We've looked at the risk factors, and we know that we have some parts of Peterborough where we have more deprivation, where we have more houses with many people living in them, where we have a diversity of language. And we know that some of those areas of Peterborough are at higher risk of having more COVID-19 cases. So we have, since June, been working hard with campaigns and social media and other preventive measures and making sure we have wardens enforcing social distancing to really act on this and make sure that we are doing all that we need to keep those rates down. More recently, we've also been we've been given more detailed data by Public Health England, really just from the start of this week, which has enabled us to confirm that that risk areas like care homes and like those more deprived areas of Peterborough are the areas where the risk is highest and where we really need to focus. So we are doing a lot of work particularly with the reducing of social distance of the national lockdown measures over the coming weekend. We are putting extra effort into supporting the communities, particularly around the Millfield, New England areas, as well as the city centre. We're putting a lot of effort there to make sure that all those social distancing messages are really reinforced, and we have people out there working on the scene and really getting the messages through to the community, and working with our community champions who are fantastic and have always been translating a lot of the preventive public health messages for their communities. And I know that councillors in the room are community champions, and that is very important. So it's just to reassure you really, you will see these higher levels of Pillar 2 cases, but I can reassure you that we are not on a rising trend. Our overall trends are downwards. And we as a community, despite having some of those risk factors, are managing that. And we are still on this downward trend. So I think people know about Leicester and that they've had a rising trend and an outbreak. We're not Leicester. We've been coming down, and we are managing this well. But I wanted to alert you to that because it is something that will be coming out. We thought it was coming out at 4, it may be a bit late, but I just wanted to fully update you on the picture. And I think all councillors have been sent a briefing as well. So you will have that information. Okay, so I think that.
Okay, thank you very much, Gillian, for the introduction to the report, and thank you, Dr. Robin, for your update on the local outbreak control plan. I will now invite the committee to ask questions of any of the directors present on any of the report and any of the individual COVID-19 emergency planning highlight reports from each of the service areas. The relevant lead officer will answer your questions regarding their specific service area. Do I have any questions? You were very quick. I have Co-opty June Ball, please.
Thank you, Mr. Chairman. Just following on from what Dr. Robin has been talking about, Public Health England said yesterday, Pillar 2, which is the wider community testing data that you were speaking of, shows Peterborough has nearly 28 coronavirus cases per 100,000, which they say is one of the highest in the country. We're currently running in 11th position. And this figure is higher than cities like Leeds, Manchester and some London boroughs. So what rapid response mechanisms, other than the brief outline that you've given, will assist us in preventing a second coronavirus spike in Peterborough, given that as of yesterday it was reported that sadly 148 patients in total have died of COVID-19 in Peterborough City Hospital since the start of the pandemic. So this is information from Public Health England that was published yesterday. I think there was a rebuttal from somebody called Black in the organisation who's here today.
Thank you, Kat. Is that going to go to Dr. Robin? Is that you?
Yes, I'm happy to start the response, though I may ask others to come in with me, but who are doing this work. So I think what was published yesterday, I don't think was officially released by Public Health England. I think there will be further publication today, which I believe will not show Peterborough in quite such a high position, although still at a higher level. So as I said, well above the national average, whereas previously we've been below. And I would re-emphasise that our deaths from COVID-19 are not high. Both our all-cause deaths and our COVID-19 deaths have not been high, and our hospital admissions are coming down, our deaths are coming down. So this is, in a sense, a change in our understanding of COVID-19 in the community, but it is not something that is a sudden change in what's happening. We are on that downward trend. But we do need to be careful. We have a community with potential risk factors, and we need to take this very seriously and take strong action. So the reason why we contained the first wave of COVID-19 and the reason why we have been successful in bringing the rates down is through the way that people behaved in our communities. So this absolutely has to be done with our communities. It's all about engagement, communication, and helping people to understand that COVID-19 is still circulating, it is still here, and that people from all communities need to play their part in helping to contain it. And it is really the same messages. It is that we still need to follow the government advice on social distancing, 2 meters if possible. Sometimes that's not possible, so 1 meter with mitigations like not having face-to-face conversations, screens or face coverings. We absolutely need to follow that, and people need to be washing their hands and practicing the hygiene measures that are required just as much now as they were before. I think you can get a sort of sense, oh, it's all over now, we can all relax, it's all fine. And that's not right. We're being allowed to relax because we have got this virus under control, but we need to keep it under control through the hygiene and the social distancing and the other measures. So, and also if anyone has symptoms, booking a test and self-isolating immediately with their household. So everyone needs to have that message about what to do if someone in your household gets symptoms. And then if you are contacted to tell you that you've been in close contact with someone who has coronavirus, then you need to self-isolate for 14 days, and people need to take that contact seriously, which will be from the National Test and Trace system. So there's a whole load of things that we can all do and messages that we really need to communicate. There are also things which our businesses can do. So there's lots and lots of guidance out there for businesses, for places of worship, for parks, all the things that workplaces need and other places need to do in order to stay safe. So there's a big piece of work to be done to keep our community safe and to communicate with all parts of our community. In terms of the rapid response that we're making, I don't know if Adrian Chapman is here, because he is very involved in with Javid and through his work in communities, working with the police and multi-agency partners as well in all the work that is going on now and over this weekend and into the future on what we need to do.
Thanks, Liz. Chairman, would it help if I gave a brief update on what we're doing?
Yes, Adrian, please. Yeah.
I'll be very brief, just to further reassure members. So the arrangements that we've stood up for this weekend come about because we've established a rapid response approach, a small team of people that meet every day to receive and interpret the data and intelligence that Liz has described. And that group is made up of prevention and enforcement officers from the council, environmental health colleagues, police, comms and community staff, youth officers, education staff and representatives from the voluntary and community sector. And they are taking information in and then are able to respond the same day, if necessary, to any outbreak of any scale anywhere in Peterborough. And to give you an illustration, this weekend, well, from today, in fact, and over the weekend and until it's no longer required, we'll be active in the Milford and New England area with some very strong messaging using our LED van. We've got youth workers out in the patch to target young people with their key messages. Our environmental health officers are visiting businesses, both in an advisory capacity, but also in an enforcement capacity if necessary. Javid, as Liz mentioned, and you all know, is working hard with our community volunteers and groups, and we've got about 30 well-established community leaders who have been working with us throughout the last 2 or 3 months, who are able to spread messages out across their communities in different languages and via various means and measures. We're also trying to include messages on Salam Radio and the Peterborough Community Radio Station. And all of the effort that we've put into the city centre reopening, we're extending into Milford and New England. So I guess I just want members to be reassured that we've got, I think, a really solid, rapid response in place. It's able to adapt very, very quickly. It has access to other resources, and we can be anywhere in the city the same day that any intelligence suggests we need to be. Thanks, Chairman.
Thank you, Adrian. Is there any other officer who wants to come in on that, or can I move on? Well, we'll move on then. Councillor Sanford, please.
Thank you, Mr. Chairman. Yeah, it's about the outbreak control plan, really. We've seen currently one place in the country which has had an outbreak and has had a local lockdown imposed by the Secretary of State. I certainly feel personally that if local lockdowns are going to be imposed, that the Director of Public Health for that particular area is the person who has got the detailed information and should have the responsibility for that. So is it possible that we could make that case to central government, that we could be given more local control, that in the absence of us being given control, if central government is going to impose a local lockdown in Peterborough, what consultation would happen with the council? And just having asked that question, could I just make a point that I'm looking at the picture of Councillor Coles, who is sat in front of a Conservative Party poster. Now, the council has clear rules on not broadcasting party propaganda. So could he either turn his camera off or remove the poster?
Thank you. Thank you very much. Okay, can we go to the officer for the answer, please? Paulina, would you like to contact Councillor Coles for me? Thank you. Okay, who's going to answer the question for Councillor Sanford?
Yes, sorry, thank you, Chair. I've already been in contact with him. Thank you.
And Councillor Sanford's question, which officer is going to take that, please?
I'm happy to start.
Please,
I think
yes, Dr. Rabbit. Please do, Councillor Rabbit.
and Gillian may well want to come in as well, because I know that she attends regional meetings where this will be discussed too. I think Councillor Sanford, I do absolutely understand what you're saying in terms of the local and national relationships, and I have to say that I haven't been involved in discussions of how this would work. I think partly because we are in Peterborough in a situation where we are not seeing a rising trend in our Pillar 2 cases. And therefore, you know, we are not in a situation where we're talking about a local lockdown. So we haven't been having conversations about it. My assumption would be that there would, because the communication and the data flow between the centre and regional bodies, particularly Public Health England and ourselves, has improved hugely over the past 2 to 3 weeks. I would certainly expect that there would be a great deal of consultation with the local Director of Public Health and with others on any issue like this. And I would also say that we are not powerless locally. So in Leicester, we're talking about a very, very big outbreak in the community with a general rising trend in cases. Most outbreaks are much more confined to settings. So you might get an outbreak in a care home or an outbreak in a workplace or an outbreak associated with a particular premises. And for that sort of outbreak, we can use local powers under the Health and Safety Act or the Coronavirus Act, or under routine public health legislation through which we can close a premises, or we can require an individual to stay in isolation in a place of safety for 28 days if they're infectious. They probably wouldn't be infectious that long with COVID-19. So we are able to deal with certain outbreaks through enforcement measures, and a combination of what we can do locally and that engagement with the community, because national lockdown really, although it was the law, there was a huge amount of engagement and of people doing it because they believed in it. I don't, you know, if people really hadn't wanted to do it, it would have been very, very difficult to enforce at the national level. So I think what we should be aiming for is to keep control ourselves, take the right interventions and the right measures if we are concerned. And as I say, we're monitoring the data daily, so we will know very quickly what's happening. So that we don't get to that position. of needing national intervention. If we do, then I would certainly very much hope that we would have that interaction and discussion. But I think that in order for the Secretary of State to use their powers, actually, there would probably need to have been a rising trend for some time, and we would be wanting to have done something to turn that around before that. So.
Thank you very much, Dr. Robin. Gillian, do you want to add anything?
The only issue I'd add is that there has been an active national live debate about whether those powers that Councillor Sanford refers to that are currently in the hands of the Secretary of State should be handed to a local level. That debate still goes on, and we have, as a group of professionals, asked the question about whether we would be able to have such powers passed locally, and that debate continues. But I agree with Liz that I think that, and having seen what's happened in Leicester, there is almost a process very carefully of escalation, whereas a lot of consultation and discussion, and we've been involved in a lot of consultation and discussion today around what Liz has already expressed to you. So at this moment, we don't have the powers, and I suspect it will be continuing to be an active national discussion.
Thank you, Gillian. I have Councillor Howell now, please.
Chair, can I raise a point of order, please?
You may, yes, of course. Councillor Jamil, is it?
It just seems that, looking at the amount of hands gone up, that this meeting could end up being so long. So I was wondering if we could do this in sections and make it a bit easier as to when we're going to ask questions, rather than it be a bit of a free-for-all for everyone.
Well, that agenda's gone out, and that's the agenda we will be working through today. We won't be able to do that on this one because we haven't got that agenda as such. So I understand your point of view, and I'm sure it'll be taken on board, but for today, you'll have to go with the agenda we have, I'm afraid.
Can I just interject, please, and raise a point of order, please, Councillor Harper?
Yes, certainly, Councillor Quine.
Thank you. I think what Councillor Jamil is trying to imply is that the agenda that we currently have at the moment is divided into sections. We're of the impression that it would be much more of an orderly fashion, as many councillors have multiple questions, to please go through the sections of the current agenda so that we can get through this meeting in an orderly fashion and an organised fashion. And that would save time rather than us going to and fro. And I think that's the objective that we're trying to highlight here. Thank you.
Okay, thank you very much. I'll ask, obviously, I'll pass this over to Gillian and Paulina. Would you like to stick with the agenda, or would you like to change how we do this? What would work better for you?
Thank you, Chair. There is a list of officers there. Were members referring to the headlines of each service area? Is that what they're referring to, and would like to just ask questions on individual service areas, one after the other?
Would that suffice? So we've got adult social care, etc., and move down the list?
I think the agenda that we've been given, sorry to interject there, the agenda that we have in front of us has 20-something sections on it. So if we were to go through each section, like you've got your bullet points, 15.6, 15.5, if we were able to go through those in an orderly fashion and to ask whether there were any questions on it, on each section, it would just come across just as in the way of an orderly fashion. That was all. It would be a bit more organised. Otherwise, we'll be going from, say, section 20 to section 5. And there are many of us waiting to ask questions. Some of us have multiple questions. So what's the format? Are we allowed to ask all of our questions in one go, or would we have to come back after each question?
Yeah, I think we would. I understand your point. We would have to come back to each one. Otherwise, we would be bouncing around.
Sorry, Councillor Kine. Sorry, Chair. Just to confirm, when you talk about the agenda, are you talking about the covering report and the paragraphs within the covering report?
Correct. It's a covering report. The Thursday, 2nd of July, 2020, 4:30 p.m. that's been sent out to us. The public document pack. That's the word.
Yes, yeah. So it's the report as within the agenda. That's what you're referring to, and then the individual paragraphs within that report.
Yes, Paulina. Thank you.
Okay, right. So I think it's over to the officers if they're happy to do that, I think, Chair.
Okay, well, Gillian, as the Chief Executive and the officers, are you happy to do that? Or would you rather stick with the agenda?
Chairman, we're in the hands of the committee. We will do whatever you want us to do. We're here to answer whatever questions you want. So we'll leave it to you to decide the best way to do it. But if you want to go through this section by section, then that's certainly a legitimate way to handle this.
Okay.
Chair, can I just raise a point of order about the reports? There may be some questions which aren't in the report because they're from the highlight reports, for example, in place and economy. Are we going to, would it be prudent to perhaps have a look at those at the end?
Yes, I think that would be a sensible thing to do.
Yeah, okay.
Obviously, if we have time, because we obviously can't run all night, but we want to get as many in as we can.
Yeah. Okay,
yeah.
thanks.
Okay, fair enough. I'm just moving through the thing now. So, should I go down each page on this then, Pauline, or how would you want me to run this to make it logical?
Chairman, what I would suggest is you've got paragraphs, so you've got section 4.
We start at section 4, then background and cause.
Yeah, any questions on section 4 and section 5, and then section, and that will then and then members can ask their questions on those sections if that's how you'd like to handle it.
Yeah, that's perfect. That works well for me. Everybody, if everybody's happy with that.
Might I just
Okay,
ask?
so,
sorry.
Yes, Councillor, it's there.
If it doesn't, so you're saying if it doesn't fit into that report, we wait to the end and ask at the end.
Yes, I think so. That way it's logical at the end. Is that okay?
Yep.
Okay, fine. Okay, so we're going to go to section 4 then in the report, and obviously those have got their hands up. If you could take them down again if you're not in section 4. So I've got the order running. We're going to go for section 4 first. So if you're not asking a question in section 4, could you put your hand down for me? Okay, section 4 then, I've got Councillor Coles, Andy Coles, please.
Apologies, Chris, you beat me to the score. I was trying to bring my hand down at that stage. I don't have a question for this particular.
Okay, fine, thank you. Co-op June Bull, I've got your hand.
Thank you, Mr. Chairman. It's para 4.5, bullet point 3, which cross-references with paragraph 23.1. Peterborough has been allocated 3.2 million towards homelessness funding due to COVID-19, and these funds are to be reclaimed once the costs have been incurred. How much has been claimed to date, and what is the recovery strategy for rough sleepers currently being housed in 3 hotels across the city? I think that might be appropriate to Adrian Chapman and perhaps Peter Carpenter.
To Mr. Hussain, I think, in the first instance, Chairman.
Thank you, Mr. Hussain.
I'm grateful, Madam CEO. Thank you.
Hello, thank you, Chair. So the application for the 3.2 million funding, we're actually in the process of submitting and will be submitted, in fact, tomorrow. So the final figures have not been calculated, but they are based on, obviously, the costs that we've incurred through the rest centre process. I'm pleased to be able to say that we now don't have 3 rest centre hotels. We about 2 weeks ago, I think now 3 weeks ago, were able to leave the Travelodge Hotel because we had managed to successfully resettle a significant proportion of the people that we were accommodating. We were then able to vacate the Queensgate Hotel last week, Tuesday, a week earlier than we had anticipated. So again, we've had a really very good success on resettling people into settings that are appropriate to their needs. We, at the current moment, have around 48 rough sleepers left in the rest centre in the Park Inn. We have 1 or 2 others in some other settings, but we use those settings conventionally. So the cost base is really around the Park Inn. That's the big cost element. And of those 48, some 20 or so are eligible. So they are people that we can actually try and work with to resettle. And the others, 28, are in different categories of not being eligible for support. And with them, we also have a strategy where we are working to either repatriate them if they are not able to work, or if they are eligible to work and wish to work, then we are trying to get them the right documentation and help them to assisting them into work. We are, the government has, MHCLG, we were in a meeting with them on Monday, and they gave us guidance that they would like us to, well, guidance was issued anyway in writing saying that they would like us to continue to provide accommodation for any residual ineligible clients, well, certain ineligible clients who meet certain conditions, and they have created some flexibility in the regulations to permit us to provide accommodation for a further period of 3 months, and that includes accommodation with support. So we will be doing that for any of those ineligibles that apply, that qualify, and continue to work with them with a view to either resettling them through work or repatriating them if that's the appropriate option. We are also confident that the remaining 20 eligible clients, we will be able to find solutions for them, hopefully between now and the end of July, when we anticipate vacating the Park Inn. Our contract is till the end of July, and we hope to have left there on or before that time. The government has also, MHCLG have also indicated to us that they wish us to continue the work accommodating rough sleepers and avoiding them being on the streets until the end of March. And this is for eligible rough sleepers. And so we are working with our partners and looking at options for further follow-on accommodation that we may be able to procure on a short to medium term basis, so that we can continue this work, and any rough sleepers that we still have remaining, or that then become rough sleepers later, between now and March, we will have accommodation and support-based accommodation for them, and we will continue this work in resettling those that we do accommodate. Does that, I hope that's answered the question fully. If I haven't, please do say.
Absolutely comprehensive. Thank you so much, Mo.
Thank you very much. Councillor Aitken, please.
Thank you, Chair. Thanks for the update, Mo. As Adrian is aware, this week I came across a Facebook post of somebody that was and says that they are still a rough sleeper. Do you know how many we currently have in the Peterborough area that are still sleeping on the streets?
So yes, so the last figure that I have from a few days ago is 17. Now that cohort of 17 is made up of several different categories. There is a category of people, a handful, maybe 4 or 5, who have never engaged with us, even throughout this pandemic process. And we continue to try and engage with them. And anytime anyone gives me a call to say one of them is willing to come in, that's like a really good day, because that's exactly what this is about, is trying to get those most entrenched rough sleepers off the streets. And I'm saddened that we've not managed to make that 100%. So there are some that fall into that category. There's another category of people who unfortunately we have accommodated in the rest centre settings, but for various reasons we've had to ask them to leave. So their behaviour, what they've done, but this is not a fixed group of people, because our approach is that we are the house of many chances. Anyone who we ask to leave, if they come back and say we're sorry, we're going to change our behaviour, we will bring them back in. You know, rough sleeping is a death sentence, and so we are always going to take an extremely tolerant approach to people if they want to have another chance. So we've got some that fall into that category, and so if they show us that they are prepared to work with us again, we will bring them back in, always. there's a third category then, and that is a category of people that have become rough sleeping, started rough sleeping more recently. Now, the government guidance changed some weeks ago, where they initially had said you have to bring all rough sleepers into the rest centres. They then changed that guidance to about 3 weeks ago to say you have to bring in those that would need to be shielded or would be in a vulnerable category. Now, our interpretation of a vulnerable category was that they would be in a priority need category. So that meant that there were some rough sleepers that now did not fall within the guidance to accommodate. And so we have a small cohort that fall into that category. Now, the MHCLG, when we spoke to them on Monday, weren't clear about whether they want us to tighten that guidance up or not. But irrespective of whether they do or not, it is my view that we have demonstrated our ability to resettle people. So I think it's only reasonable for us to offer those people the option of moving into the rest centre and helping to resettle them. Because if we can do it with the 100 and so people that we've done it with already, why can't we do it with a few more? And I would rather aspire to having fewer rough sleepers on the street than 17. I think that we can do better.
Okay, thank you very much. Councillor Joseph.
Thank you, Chair. Thank you, Mo, for your report. Can I just clarify? You said that there were some people who you were helping to get back into work, etc., the non-eligible ones. If you can't find them work, which obviously I appreciate can be quite difficult with so many people on furlough and obviously businesses not operating at the moment, what then happens to them?
Well, the government's relaxation of the regulations is for a period of 3 months. So we have 3 months to work with them. And after that, the legislation does not permit the housing service to work with those clients. They're ineligible, so we can't provide them with active advice or assistance.
So they would effectively be back on the streets if they were unable to find work?
Well, they would still have the option of being repatriated, and we would offer them that option. And we would always urge somebody who has tried to find work for that period then to go back to, because at least they're going back to their family and their community.
Okay, thank you very much.
Thank you.
Councillor Hemraj.
Just going back on what you were saying about the rough sleepers, after 3 months, if they're unable to find work and we can't support them, are you actually lobbying government to actually get that changed? Because 3 months is not a long time to find work, especially now when we're potentially going to have over 2 million people unemployed. Thank you.
Thank you.
We aren't directly, but certainly our partner agencies, including the Light Project, I know are working with other agencies and making that case. And we have invited the Light Project to come on to some of the meetings that we've had with the ministry, so they have heard those voices.
Okay, thank you. Thank you. Okay, any more questions on section 4? We'll move to section 5, please. Local public health context. Councillor Hemraj.
I've got 3 questions here, and I'd just like to ask Dr. Liz Robbins, how important is it to have very up-to-date data to actually prevent any possible local lockdowns? And the track and trace, test and trace. We know that a lot of people that actually got COVID symptoms actually...
Councillor Hemraj, so that's at section 6, which you haven't got to yet. We're on 5.
Oh yeah, sorry.
Anything else on 5? We'll come back to you on 6.
No.
Is that it on 5?
Yeah.
Okay. Dr. Robin, please.
It is very important to have up-to-date data. So you're completely right, Councillor Hemraj. And as I said earlier, the communication around the central and regional data on testing has been improving very much over the past 2 to 3 weeks. So I now get several data feeds which I pass straight into our surveillance group, which are coming down from test and trace, from the different pillars of laboratory reporting. And we're getting regular information from Office of National Statistics on mortality and other things. So we are getting a much more immediate and up-to-date data coming to us from regional and national sources. We also get a daily feed in from our hospitals about the number of cases in hospital, the number of people who've tested positive in hospital, the number of 111 calls that are being triaged for COVID symptoms. And we meet daily in our surveillance cell to review this data and to see what is happening with it. And as I say, we've just started to get the more detailed geographical data, the anonymized but postcoded and data, which is really helpful. So it is essential to get really good data. And the data that we're getting, it's still not perfect, but it is a step change and very much improved, I have to say.
Thank you very much. Anything else on 5? Councillor Henrich, have you got another one on 5?
Yeah, can I just come back on that? The up-to-date data, I know the hospital gives up-to-date data as it comes through, but what about the community? How quick is that being released? Are we waiting 2, 3, 4 days before you get the data, or is it 24 hours?
Well, the way that the data is presented is usually on the date that the specimen was taken for a test. So you are going to get some delay because that specimen then needs to be processed in the laboratory and turned around, and the result comes through into the system, and then it gets fed back to us. So clearly there will be a delay from the specimen date. But the data that is coming through to us, I genuinely think they are trying to get it through now as quickly as they can.
Okay, thank you very much. Okay, we'll move on to, are we still on 5? I've got Councillor Jones.
Thank you, Chair. First, can I just check with you on 5.1, the figures now have been superseded by the Pillar 2 results, and we've got the response, which is the rapid response. Is there likely to be a Pillar 3 that we still don't get at in terms of the hard to get at communities that I'm assuming people like Adrian are working with? Because it now seems that this report has been superseded by the information you just sent out about the number.
The 2 big testing pillars for active cases are the Pillar 1 and the Pillar 2. Those are the 2 main labs that are running the cases. You do always have to look out for very specific arrangements that might have been set up by a university or other institution, and that's one of the things that we do in our local outbreak control plan, is make sure that where there's sort of small arrangements that have been set up early on, that all those results are actually feeding back into the right place, but those wouldn't be big numbers. So generally we have covered that. There are further pillars of testing, but another pillar is the antibody testing, which is looking at whether people have antibodies when they've had the disease some time ago, and also a big research pillar to take forward. But it's the Pillar 1s and the Pillar 2s are the main ones.
Okay, thank you very much. Okay, we'll move on to item 6, which is test and trace. Councillor Henrich, please.
My questions, I've got 2 questions here. So we know that some people who've got COVID-19 are actually asymptomatic. So, and it was suggested at the last scrutiny meeting about mass testing. Would that actually, if we had mass testing in the Peterborough area, would that actually help against any potential local lockdowns? And also Leicester is only 1 hour drive, less than an hour drive away. And are you working with their local authorities on how to prevent their residents actually coming to visit Peterborough? Because as we're coming out of lockdown, how do we prevent people from Leicester coming to Peterborough for the shops, the clubs, the pubs? And that is quite, we are a close city to them, and that would be one worry of people travelling down from there. Thank you.
Okay.
Right. Okay. So asymptomatic screening has been helpful in healthcare settings and care homes, where you tend to see the highest percentage of people infected. And some of those people will be showing symptoms and some will not. So it has its benefits. I think that the question of doing it in settings where the overall sort of proportion of people who are infected at any one time is much lower than that. You really have to look at how beneficial that would be in terms of the amount of resource and consumables that you would have to use for a whole population. So it's good in settings where there's like very high percentages, where you know, at the peak you might have been talking about you know, some sort of percentages, sort of 1 or 2%, say, of or 3% of a healthcare institution. I think in Western they had very high percentage of hospital workers who were infected. So in settings like that, then the asymptomatic screening is really useful. At a population level, I think in theory, yes, you could pick up everyone who was infected at that time and you could isolate them, and you know, it would help to contain things. But I think the practicality, given that we're actually talking about not very large numbers in relation to the whole population, I think is the issue, which is why this is being proposed on a research basis. I think in some, and I've looked into the Norwich work. I don't think they, from what I heard, it wasn't proposed for the whole of Norwich. It would be proposed for some areas within. It is really just the practicality of that, Councillor Hemraj, I think is the issue, because the overall proportions in the population are still quite small. And in terms of people coming from Leicester, I think that that probably is not a question that I'm able to answer at the moment. I'm not working with Leicester. I think there's many places that people could go to from Leicester. I think I would need to really understand what their lockdown was. And also, again, an awful lot of people in Leicester wouldn't be infected. So I think that is a question I would have to take away, Councillor Hemraj. We're not doing anything on that at the moment, and I think it would be very difficult to do that. And it is more about Leicester working with their population to say, please stay at home at the moment, and don't don't travel large distances, given the situation that we're in. I think Leicester really does need to take some responsibility for that, would be my personal view, because there are many cities around that area. We are nearly an hour away, so it's, you know.
I just come back on the mass testing. We've got a number of warehouses in Peterborough, Amazon, Tesco's, IKEA, just to name 3. If staff had started to show symptoms, would you be going into those companies to say, actually, you need to start testing those staff?
What we would do in a situation like that, which is all in our local outbreak plan, is we would have an incident management team in which we would involve the premises, the Public Health England communicable disease specialists who are dealing with these issues right around the east of England, and they would lead the incident management team. Obviously ourselves, environmental health, any other relevant officers would have a very careful discussion of the situation. And in that situation, depending on the numbers of cases and whether they appeared to be sort of very identifiable to certain clusters of people, a bit like the bubbles in schools or something like that within the premises, or whether there appeared to be something much more widespread going on, asymptomatic testing of all workers would be an option. And one of the things in our local outbreak plan is to make sure that we can rapidly deploy testing if we want to do mass testing on a particular site. So yes, it would be possible, but it would depend on the view of the incident management team and that discussion with this setting.
Would that be dependent on how many members of staff have actually gone off with symptoms? So if you only got 2 or 3, but then you suddenly got 100. So if 100 staff came off with showing symptoms, would you be going in saying that you need to test your staff?
I think that would be very likely, yes. I think it would definitely be a major issue for consideration there. And I think the important thing is that we can ensure that we have the capacity and the ability to do that when the situation points to that being the right thing to do. Yeah.
Councillor Kate, please.
Thank you, Chair. It's another question for Liz. It's about the track and trace. This afternoon, the Department of Health released figures, I think they're national figures, where they said that there were 6,000 new cases. And from the track and trace, they'd managed to find 23,000 contacts for those 6,000. And for me, I'm thinking that alludes to a possible R rate of 4, which is a little bit high. Do we get that potential if that's the number of people that those 6,000 people have actually come in contact with? Do we get that level of detail locally as well?
Sorry, yeah, I'm not on mute. So we do get information, sort of summary information fed in confidence to us from this system. So some of the information that we receive is, I think more will become public domain as time goes on, but it's partly because it's quite new. So we need to be sure of it. But we do for the surveillance cell get through information on from the contact tracing as well. I would reassure you that, and I don't want to get the messages wrong here, it's really important that people who've been in close contact with someone who is a case do self-isolate for 14 days, because we've got good international evidence that this is a very important tool, not the only tool, but a very important tool in stopping the spread of the virus. So it's really important that people self-isolate. But only a proportion of those people will actually develop symptoms or develop COVID-19. So it's a matter of being at higher risk. It certainly isn't that because, you know, you've got 4 times as many contacts as cases that your R rate is 4, because a lot of those contacts won't develop COVID-19. But it is important that they self-isolate.
Okay, thank you very much. Councillor Aitken.
Thank you, Chair. Just a statement, actually, rather than a question to Liz, and that's that I actually fully agree with Councillor Hemraj with regards to Leicester. I'm aware of several people with fairly large families that actually went off to Leicester in the last 2 weeks. And my fear is that if eventually Leicester come out of their lockdown, then those families will again go back to Leicester, those individuals, for shopping and whatever. So I think it's something that we really do need to just be aware of and think about, because obviously if they're high, we do have that potential of increasing our cases.
Thank you. Thank you very much. I think that's understood. So we'll move on to, I've got Councillor Haynes, please.
Oh, hello. In section 6.2, it says about working on our local test and trace activity, and it said about ensuring that there are sufficient staff and volunteers trained and able to take up responsibilities. Is that training still ongoing? Where do we stand in terms of getting the staff we need for the track and trace to work effectively? Thank you.
Okay, so we've got our plan, and now we are implementing it. And part of implementing that plan is our workforce work stream, where we have 2 particular areas where we would like to strengthen the workforce further. So we have people who understand and are able to do outbreak management and contact tracing in the system already. So the staff the specialist staff on the public health team, environmental health officers know a huge amount about this and they do it, it's part of their role. And we also have some healthcare staff, those who work in the sexual health services are used to contact tracing in that arena, and there are some other professional groups who already are trained in this and understand. And also I don't want to miss the health service infection control nurses who do a great job with our care homes. So we already have a number of trained staff in the system who are dealing with the sort of level of you know, the sort of, because we, you know, the ongoing small level of care home outbreaks or a workplace outbreak or whatever, there is a sort of level that we are dealing with now. What we want to do is to train up in particular greater support for environmental health officers, because really what local authorities are being asked to do is to make that frontline intervention with the settings that are local. So we don't think that we're going to be able to find lots and lots of environmental health officers just ready to employ, because they are a bit like gold dust. But we want to train up officers who can support the environmental health officers and be supervised by them, and get a significant extra group of officer support there. And that's not just about dealing with outbreaks, it's actually about working with businesses on prevention and just keeping up that prevention and enforcement around COVID-19 safe workplaces. And environmental health can do a lot on that, working in high-risk areas. So that's an area which we want to develop rapidly. We also want to further strengthen the overall outbreak management capability in the public health team, and we want to train people in community groups. This came through very strongly from our Health and Wellbeing Board, the role of some of the groups that have been working with the community hubs, who've done a fantastic job in supporting vulnerable individuals, but actually it's about our community champions, our community groups being trained in the preventive messages. So not so much the specialist contact tracing and so on, but in those general preventive messages. So there's a lot of training that we want to do, and training is part of our plan, but we have a big job now around rapid implementation, because we are at a level which we can manage at the moment, but we want to be prepared to do more as and when needed. So that is absolutely in our plans. And now we have got the money from central government, we are able to start to employ those staff and, you know, do all of that work, working very closely with Public Health England Health Protection team, who have the training packages.
Thank you, Dr. Robin. Okay, we'll move on to section 7 then, which is the Peterborough Hub. Any questions? Yep, Councillor Skipstead, please. You've got your mic off, Councillor.
Yeah, sorry. I'm not sure whether this fits into this section or not, but it's a question around vulnerable residents who might not be getting the support they need. So the question is that there are residents who during this crisis have fallen through the cracks regarding financial help and support. For example, some have become carers because it was too much of a risk to leave a relative in a care home, for example. The hub was available for food and other emergencies, but during lockdown, what did the council do to monitor that people were coping, for example, with lack of income due to becoming a carer? And I'm not sure who to address that to. It could be Adrian, it could be, I'm not entirely sure.
Shall I pick that up? It's Wendy.
Yeah, certainly, Wendy, yeah.
Thank
Okay,
you.
no problem. Could be me or Adrian. So thank you for that. Thank you for that question. We are very aware actually of people who might not have been known to us before. So we've been doing a lot to try and identify those people that need our support. You'll know that we have a Peterborough hub with a direct number 747474 that anybody can ring to get a variety of different help. What we have done is we've thought about those people who might need additional support. So things like we've been in contact with all of the carers that we know in Peterborough and asked them what support they need. But also we've got in contact with people who have been open to adult social care in the previous 6 months, and that case closed, just to check that they have still got the support they need and if they need any other support. you're absolutely right that people we're supporting at the moment, we wouldn't have thought we'd have needed support in the past. There's many people who have had packages of care that aren't in place now, because friends and family haven't wanted to go in because they're worried about infection. So people are much more on their own than they were before. They haven't got that informal support network. So we are so lucky across Peterborough because we've got in excess of 60 voluntary and community sector agencies and organisations spread all around our city, as well as specialist organisations, where when the Peterborough Hub is made contact with, we've been able to fulfil every request that has come in. And as you can imagine, there's a whole variety of requests. It does go from actually food, either people not being able to afford food or not being able to go out and get food, delivery of medication, but also things about people feeling really down and isolated. And that's become more apparent as the lockdown's gone on. So we've got many of our agencies and organisations actually just making befriending calls to people on a weekly basis. And the feedback we've had is absolutely amazing about the big difference it's made. But also we've been sending out things like craft packs, activity packs to adults and children to give them something to do as well. More recently, we've been asked for practical help. So things like gardening. It's a real concern that some older people's gardens weren't being tended, and that could lead to more antisocial behaviour because things look dishevelled. So volunteers have gone out to cut people's grass. So that's just some example of the key things we've been able to provide. And as I say, we keep getting information out, be that we've had it in the Peterborough Telegraph, I've been on the radio. A leaflet has gone out to every household in Peterborough twice now with the contact number on, but also what we can provide. But if people have got any other ideas about how we can promote it even further, please let me know. And the other thing I've done is I've been in touch with all the parish councils, and I've had a Zoom meeting with clerks of the parish councils to talk about how we can work more effectively with them, not just now in the pandemic, but also in the future.
Great, thank you very much. That's the answer. Okay, there's nothing else on 7. I'm going to move on to 8, which is care homes. Okay, Councillor Quam, I've got you first, please.
Thank you very much, Chair. My question is probably directed again to Wendy, actually. So it refers to section 8.5, the table there, and the column is managing the market, which is the first column, and the last paragraph that refers to secured additional residential nursing beds and extra care capacity. I'd just please like to ask, where is the extra care home and residential care home capacity being accommodated? Is it within care homes themselves that we have here within Peterborough, or other sites have they been identified? Thank you.
Thanks, Councillor. I'm going to ask Will Patton, if you don't mind, to answer that because he'll have the detail. Thank you.
Yeah, no problem. So we secured an additional 106 beds in Peterborough, and that's from existing providers. So existing providers that we both contract and don't contract with. So these are operators within Peterborough.
Thank you, Will.
Okay.
Councillor Co-optee June Ball, please.
Thank you, Mr. Chairman. How confident are we that rigorous testing before hospital discharge is happening from the 15th of April to date, given that there's been, I think, 140 deaths in care homes involving a confirmed or suspected case of the virus in the Cambridgeshire and Peterborough local authority area between the 10th of April and the 26th of June. And just to tell you that my source data comes from an FOI to the North West Anglia NHS Foundation Trust. So I would say that's certain data.
Shall I take that? Question. So it's a really important question. Yes, we are confident. So we have an agreement with all our acute trusts that before we take anyone, accept any discharges from hospital, we know what their test result is. That's national guidance, and that's something that we are also sticking with locally with our NHS colleagues.
Okay, thank you very much. Thanks.
Can I come with supplementary on that? So given the amount of deaths and given the amount of testing, how do we compare to our neighbouring counties or indeed the national average?
Charlotte, would you know the answer to that one?
Is that in terms of deaths?
Indeed.
Yes, that's probably something for Liz, actually.
Dr. Robin, would you know the answer to that one?
Yes, we have comparative figures on care home outbreaks, but I don't have comparative figures in deaths on care homes, so I'm happy to take that away and ask for our public health analytical team to look at that, because the percentage of outbreaks reported doesn't necessarily link to the number of deaths, because deaths may be more likely when outbreaks aren't reported and they aren't picked up quickly. So if I could, I'm happy to take that away and see if our analysts could try to do that sort of analysis. I think I have seen something on it, but I wouldn't be confident enough to quote it without asking my analysts to take a careful look.
Grateful, thank you.
Good job, Robin. If I could, Councillor Ball, or could you just keep that as a recommendation towards the end so we don't forget? Okay.
Will do.
Right. Then we're going to section 9, which is the care home support plan. And we'll move to item 10, which is infection control fund. Item 11 is personal protective equipment, PPE. Yes, Councillor Quine.
I work in primary care. Recently, only yesterday, it was brought to my attention by our practice manager that reserves of PPE at Alconbury, which is one of the main hubs that supplies primary care, is low. In fact, so low that we anticipate that supplies could run out this week. Is there anything that, as a council, we do to contribute to that supply, or is that separate? Just for my own clarification, and how are we doing with regards to supplies with care homes? Thank you.
Thank you.
You want me to pick that up?
Yes, please.
Wendy, I'll pick it up as best as I can, Councillor. So let me take the second question first, if I can. In terms of care homes, as a local authority, we've made a commitment that if a care home is struggling to source their own PPE, then we will provide that from our social care supplies, which we absolutely have done. I'm pleased to say that many of our care homes are reporting at the moment that their supplies are much better than they were. In terms of primary care, that is a responsibility of the CCG. So it would be, I honestly wouldn't know about the supplies for primary care. So apologies, I'm very happy to try and find out for you and report back.
No, that absolutely clarifies it. Thank you.
Thank you. Councillor Hembrow.
Over the PPE, are the council getting the best deal possible with PPE? Because I know the prices have completely inflated because everybody wants it. And are you working with care homes to actually source the best deals for their PPE if they're unable to access it from yourselves? Thank you.
Thank you.
I'll take that again, Councillor. So we have an officer who has learned over time, I would say, to work with the suppliers of PPE. And I do believe we're getting the best deal we possibly can within the circumstances. But as you know, the prices increased significantly. And our commissioning services work with the care homes to provide them with details of suppliers who are credible suppliers. And obviously the cost is expensive, but the best possible cost that we can find.
Okay, thank you very much. Right, we'll move on then to 12, which is new model of support to care homes.
Sorry, can I just come back on that one?
Oh, sorry, yes, certainly.
Yeah. With the PPE in the care homes, I don't know whether it'd be worth recommending, or if you've actually considered about actually the care homes actually be able to source the PPE from yourselves, because surely the more you buy, the cheaper it is. and then sell on to the care homes? I don't know if that's allowed.
Probably allowed. It's not something we are considering at the moment. And to be honest, the care homes seem to be managing reasonably well with their PPEs and their supplies at the moment. But it's certainly, if we were asked about it, then we could consider it.
I'm just thinking, because obviously it will keep the cost down for the council and cost down for the care homes if you both come together where you both bulk buy. Thank you.
Okay.
Thank you very much. So we're at number 12, new model of support to care homes. Now, Councillor Hemorrhage, I've got your hand up for this one too, yes? Oh, no, that's a sorry. So anybody else? No. Okay. And 13 is schools reopening. Councillor Day.
Hello, I just wanted to ask a couple of questions around the free school meals in the summer and also assessments sort of going forward in the future. So first of all, the introduction of free school meals worth 120 million is very much welcomed. Are we in a strong position as local schools and as an authority to make those provisions locally over the summer break? Also, I just wonder, this is sort of really going forward sort of into next year really, but have there been any discussions regarding assessments? Will there be a rethink for 2021? Will there be maybe a combination of teachers' assessments and slimmed down exams in terms of GCSE, and certainly for baseline and SATs tests? Should these tests take place as they usually have been doing, given the missed face-to-face learning opportunities? And that sort of scaffolded and modelled approach that we need for our pupils in Peterborough. Just wondered whether local head teachers have given that any thought, or whether there's been any guidance from Ofqual or any conversations around this. Thank you.
Jonathan, is that you?
Yeah, thanks, Chair. So in terms of free school meals, what will be offered in the summer is a direct voucher through an organisation called Edenred. There's no local provisions. There would be food parcels or anything like that. There will be a £90 voucher made available for each child that is qualifying for free school meals. In terms of assessment, we've had guidance through today from the government in relation to changes. Much dialogue still going on. What we do know for the assessments for the summer in 2021, SATs will happen. So primary assessment will continue. The only one that won't go forward is the early years baseline assessment, which has been postponed for a year. And in terms of GCSEs, there is conversations at the moment about delaying them, maybe till July, to allow children to catch up with their learning. And Ofqual at the moment is reviewing whether there is alternative options around how some of the GCSEs may be considered, but nothing has been.
Okay, thank you very much. Councillor Coles, Andy Coles.
Thank you, Chair. Again, a question about education. It's in three areas, really. The first one, Jonathan, is about the vulnerabilities of our education system being so well used with so few spaces normally, and also with the financial issues that the multi-academy trusts and other schools are facing. Looking over the horizon, do you think that we are going to be able to cope with the situation we have now, or whether it's going to become extremely difficult to maintain the level of school provision we currently have? So that's the first question. The second one is really around how confident we are that when children eventually return to full-time education, whichever way it's provided, that we have any idea about the baselines or the impact of homeschooling over time, and what we might be doing to judge that. My third question covers Ofsted, and that was how they might be working to judge response to COVID, because it's obviously going to completely change the way that they assess the way that schools are excellent, good, or otherwise. Thank you.
Thank you. Jonathan, when you're ready.
Yeah, thank you. In terms of, so far we've had great success. We've got good rates of children returning to school. It's going to be challenging when numbers increase. I'm not expecting numbers to increase in the last couple of weeks of term. But obviously from September, there was an expectation that every child returns to education. And that's going to be challenging. Our schools are well funded and we've not got huge financial challenges currently in our schools. The government recently announced an extra £1 billion for catch-up We don't yet have the details of how that's going to be allocated, but that will be focused on deprivation. So it's likely our schools will receive additional funding, but we're going to have to judge in the autumn exactly what the impact is, and particularly the challenge on complementary services, social care and others is going to be the area where we need to be really focused on what that means. In terms of children coming back, the feedback I've had from heads so far is that children haven't gone backwards in terms of what normally happens over the summer holidays. They tend to go backwards. It tends to be they've stabilised. There is obviously a need to catch up. There's been a period of lost learning, but our approach to distance learning, I think on the whole, has been effective. And most schools, I believe, will baseline children in the autumn to see what gaps they have and think very carefully about their curriculums and how best the children can catch up during that time. In relation to Ofsted, an announcement came today that inspections will be postponed until at least the spring term. Ofsted will be visiting schools to check progress. They will be working to monitor how schools are implementing recovery actions. We work very closely with our HMIs, the inspectors that have been seconded to us, to make sure there are good, effective plans in place for schools. So they are doing the right things to get children back on track and recovered. So we'll wait and see how Ofsted respond post that. At the moment, it's a very collaborative approach.
Thank you very much,
Chair.
Okay, Councillor Skipstead.
Thank you, Chair. I've got two questions for Jonathan. The first one is, given that years 10 and 12, these school years have effectively missed what will be probably 6 months schooling prior to starting their exam year in September, how is the council helping schools to share good practice for these particular 2 years, years 10 and 12, doing GCSEs and A-levels next year? That was my first question. The second question is a bit broader. It's question around that there used to be Vivacity-led provision for exercise and wellbeing held at sports centres during the summer holidays. This year, how are key workers going to access the childcare that this provides to enable them to work, and how are Vivacity or the council planning to offer this much needed programme of wellbeing and exercise for the city's children prior to their return to school in September? Thank you.
Okay, so in terms of the work around year 10 and year 12 and sharing good practice, we meet fortnightly. The secondary heads and myself and my team meet with fortnightly. We're sharing information, we're sharing best practice. You know, I'm sharing information we get from Cambridgeshire heads too. So there's a really collaborative approach to resources and ways of working that will continue, I'm very sure, after this period. I may ask Adrian to come in on the second point around Vivacity, but if I set out the context in terms of summer provision, we received guidance from the government yesterday about how that can be set up. We were obviously concerned that the protective measures in schools at the moment, the bubbles we're running, wouldn't be allowed post the end of term. The confirmation is that we can reset those groups and provision can run with a set of protective measures in place. So at the moment, we're trying to interpret what that means, and we will be providing advice because clearly we want key workers to be supported during that period. The government very clear direction, however, is that schools will not be continuing to provide, and we will look to the normal arrangements to fill those in. But in terms of Vivacity, Adrian or Amanda may want to cover that.
Okay,
I'm happy, Chairman, if that's okay with you, just to finish that point off. So obviously the first thing is that Vivacity and all of the leisure providers need to wait for the appropriate advice from government to be able to open services up. Just at a local level, it's worth noting that Vivacity remain responsible for all of the services that they currently run for the current 90-day transition period that we're in, and I'm sure there'll be some further discussion and questions on this later on. I happen to be meeting the Chief Executive and the Operations Director of Vivacity tomorrow. At this stage, they haven't let us know what their reopening plans are when they do get the green light to reopen services. So that would be my aim tomorrow, to try to provide some clarification and be assured as soon as we know what those plans are or ways in which we can support the reopening of services, we'll let members know ahead of anybody else.
Thank you.
Thank you very much. Councillor Joseph.
Thank you, Chair. One of the huge issues that I've certainly come across is that we have an issue with period poverty well, not just in Peterborough, but across the country. And that was obviously being addressed by schools, with the schools being closed and with those particular year groups obviously not back in school. What, if anything, has the council done to address this issue, and is there any support going to be offered during the school holidays and obviously going forward? Thank you.
Okay.
I'm going to need to go away and talk to the schools about what's in place. The government released some information yesterday on their approach. Obviously, they were going to allocate funding to schools to support in this area. Happy to come back with a note on what's happening and how best we may take that forward, and certainly I'm happy to engage with head teachers around that as well. So I'll come back to you on that one.
Thank you, Jonathan. Councillor Jamil.
Thank you, Chair. Back to Jonathan again. Jonathan, I have an issue with the schools who are teaching year 12s at the moment are going to be going into year 13. Now, they're going in for an hour and a half a day at the moment, most of them, and most of the students that I've spoken to saying it's actually a waste of time because the schools actually aren't doing anything meaningful other than meeting a tutor. Now, these students are supposed to be preparing for university, supposed to be getting CVs ready, and so on and so on. My fear is that we're going to lose this year group because they're missing out on so much, and then when they get off to university they may struggle even further. And if you think the costs of university, I think GCSEs, they may have grasped something because you've got a further 2 years, but I think we're losing the year 12s, and I don't think the schools are doing enough.
Okay, well, I'm obviously happy to pick up individual cases with you in terms of schools. The guidance is quite limiting in terms of how often pupils can go in. They're only allowed 25% of their cohort in at any one time, so there is some limitations there. The expectation for government at the moment is around distance learning and providing that. Obviously, part of A-levels and readiness for university is independent learning as well. So, I take on board completely your points. There is some thinking going on, as I said, about delaying when the assessments happen for post-16 as well as GCSEs. So, but equally, if you want to give me some information, I'm more than happy to speak to head teachers and raise that further about catch-up. They'll be acutely aware they're judged on outcomes and they need to get this right. So, I'm sure they have plans in place, but happy to take up individual issues.
Thank you very much. Councillor Hemraj, please.
Sorry, mine basically is about year 13. So year 13s were supposed to sit their A-levels this year and their grades are being guessed on predicted grades. Now, if they don't get their predicted grades to enable them to go to university, they've been told that they can go back to school to sit their A-levels. Now, how are the schools going to accommodate these students to sit their A-levels when we've already got pressures with the social distances with the other years? Because this is an added group of students on the schools that wouldn't necessarily been there. Thank you.
We're still waiting for absolute detail around how they're going to work and operate and the timings and things like that. We're hoping it's a small number of students. We hope that the quality of the assessments, the use, particularly at A-level, of the GCSE results as a prediction will mean that an appropriate grade will be given. But there will be small numbers, but schools will accommodate it. It's a requirement to deliver it, and we will find a way, means to use the school building to make that happen. But as and when more information comes through, I'm happy to update.
Thank you very much. Okay, Councillor Robinson.
Thank you. My question's around school transport. With the kind of guidance that year groups are going to need to be kept apart at secondary schools and primary bubbles when we open further in September, my concern is about the children that we put into shared taxis for funded transport, the buses that go out to Glinton that will have lots of different year groups on, or all the children who perhaps from Queensgate catch buses to secondary schools. Now, I know I've raised with you already about a cycling plan, which is the basis of a recommendation later on in this meeting, but how is the council school transport plan being adapted to make it kind of COVID safe and compliant with government guidelines?
Okay. Well, we've obviously today we followed those guidance through social distancing. There's some new guidance been released today that talks about, as you say, running bubbles, slightly different way of working in terms of that social distancing. This is a national issue currently. I've been working with colleagues in the Eastern region. You know, we are going to have to provide more if we stick to those guidance. They will need further funding, and we will need to look at how we deliver that provision as well, because we don't have lots of spare buses, particularly with tail lifts. So we're going to have to get creative. We have been promised additional guidance for local authorities to come through in the guidance that came out today. And obviously we will put together a plan to make that work once we've had a chance to speak to the schools about how they're going to be running, because obviously there's an interaction between the two. So it's something very high on our agenda. And as soon as we know more, we will certainly respond to it and you know, do whatever we can to meet the need for transport.
Okay, thank you very much. Councillor Rush.
Hello there, Jonathan. A lot of staff at Sailfields, like other schools, have worked extended hours for over 3 months now, including holidays. There are concerns for their well-being. Do you know if schools will be asked to stay open during the summer holidays for key workers?
No, Brian, the very clear direction from government is that schools shouldn't open for compulsory education. Obviously, some schools do run summer clubs and will continue to do so, but there's no requirement for key worker or vulnerable groups, unlike in the previous holidays.
Thank you. Councillor Haynes.
Thank you. You mentioned about the report, the guidance that came out today about reopening schools in September, and I've only had a brief look through it. But thinking about my school, it looks incredibly unimplementable. But you know what? I know it's in the future, but do you think that schools are going to be able to meet the challenges in that guidance in terms of distancing and bubbles? And if come August, schools are saying we can't put these safety measures in place and still provide a full curriculum for all our students all at once, what do you think is going to perhaps happen? I mean, would the local authority to support schools making alternative provisions, maybe only having year groups in on certain days? Or is it that the safety measures are maybe going to have to be slightly dropped and we're going to have to just accept that children are going to be mixing in schools come September? So which way do you think it's going to go? Or do you think these steps can be implemented as they are in the guidance?
I think that's a great question, and the guidance is huge and we're working our way through it. My reading of it is that secondaries particularly are going to have a more challenging time delivering against the guidance. I think for primary it's an extension of what we've got already. It's very clear in the guidance that schools should undertake risk assessments. You know, they should have the protective measures in place. I would support a school that felt that as a result of their risk assessment it wasn't safe to open, that they don't do that. Obviously it will be scenario based, so I can't say how many or what or where they work through. The guidance, however, is also very clear about the need for schools to continue to provide a remote learning offer as well. So I suspect there's some thought in government in that direction, that if there are issues, we will continue to support learning at home. So obviously, again, happy to look at that as we go through it. I haven't had a chance to speak to secondary heads yet, which I'll do next week.
Okay, thank you. Lovely.
I think you're talking to me, Brian. Sorry, Chris. I would take it that he is. My question is to Jonathan Lewis as well. When you look at people going and dropping children off at school, I think there's going to be a large increase in people taking their cars, and that's going to cause problems with traffic. It's going to cause problems with complaints from people blocking roads, people getting to work as well. It's going to delay many things. How are you hoping to work around that issue, please?
I think that's a very valid point, particularly in the initial phases. The one thing it does suggest is that we may wish to continue to have staggered start and finish times. That's a protective measure around making sure too many adults aren't in one place. So that's something we will consider. We've also been doing some work looking at how we can use the roads outside the front of school, make them pedestrian free. A program called School Streets, whereby we would manage that drop off and arrival time in a different way. But it definitely needs some thought, and our risk assessments already includes reference to access to buildings, and it's one that I'm going to be encouraging head teachers to thoroughly consider, particularly in that early phases when we were expecting to see more come in. I'm very hopeful that the health kick we've had through this crisis will continue, and children and parents will walk to school or bike.
I am just aware that some parents will be going to work, and that will necessitate them to leave the child off at a certain time, so may not work with the way the school wants to work. Something that I think you might need to think about as well.
Yeah, we have, I mentioned the after school clubs, the out of school club provision, that will be back online in September. So we may be able to provide flexibility we haven't been able to do recently through that as well. But you make a very valid point.
Hello, sorry everybody. The chair has just lost connection with the meeting. He's trying to reconnect at the moment, so if we could just pause the meeting for a moment. He's trying a different piece of equipment.
Okay, I think I'm back. Can you hear me?
Yeah, thank you. Thank you, Chair.
Okay, I'm back. Sorry about that, everybody. I do apologise. Okay, fine. So, Councillor Bisbee, I just heard the end of the message with Jonathan. And I'm just checking I've got nobody else. So I'm going to move on now then. And the next section is City Centre reopening. And I have Councillor Howell, please.
Thanks very much, Chair. Welcome back. 2 questions, please, about the city centre reopening. I've seen the phrase shop local, which is very welcome, but I would just like some clarification on that, please, because for townships like Orton and Hampton, shopping local means Serpentine Green and the Orton Gate Centre. So should we be encouraging our residents to go into the centre of town to help the high street, or should we not? Should we instead, for the townships, our message be to remain in the townships because of the COVID? So I'd just like some clarification on that, please. And my other question is, given the amount of antisocial behaviour we've seen as lockdown has been relaxed, with people littering everywhere all across the country, are we sufficiently resourced to cope with any antisocial behaviour that's very likely to take place on Saturday when pubs and other services become open again? Thank you.
Thank you. Good. Which officer is going to take that one?
I'll take that one if I can, Councillor Harper.
Yes,
thank you, Councillor Howell. Yes, on the first one, I think shop local is to shop local, and I think the important thing that we can do is make sure that anywhere that people want to shop or visit within the city is safe, and that's what we've certainly done in the city centre. So ultimately, it's a choice for residents as to where they go, but we can say very clearly that the city centre will be, is and will be safe for visitors to go to. And on the second point, yeah, absolutely, there's an operational plan in place for Saturday, for July the 4th. So we've been working very closely, the PES team, with volunteers and the police to be ready in case there are any issues that arise during the course of the day. And there's also going to be a reassurance presence as well around the city centre. So there's a very detailed operational plan that built on the previous plans that were put in place when the shops opened on the 15th of June. But obviously this time around, it is the pubs and restaurants. So yes, that's all in hand.
That's great, thank you.
Thank you very much. Councillor Quine, please.
Thank you very much, Chair. My question is in regards to 14.2. What is overall the longer term plan in terms of improving the experience of shoppers coming back? Recently, the media headline of Peterborough being included in one of the lists of unhealthy high streets wasn't such a good element to read. So are there any thoughts about how we can welcome shoppers back onto the high street, given the number of fast food chains that we have and pawn shops and betting pits? Thank you.
Chair, I'll come back on. Well, if I may. Yeah, build back better is the next phase beyond the current phase. I think when we see surveys like this, they do come out quite often. I think we can be dubious about them. I don't know what the status of it is. It doesn't mean to say that we need to make sure that we are addressing any needs that there are across the city to make it a more attractive place for everybody to want to visit. So the plans that are in place that we know about for the Station Quarter, the University, North Westgate, the investment that's already taken place around the Queensgate Centre, I think are testament to the ambition that there is to revitalise the city centre even further, to make it an attractive place for people to want to visit. We've also got the Business Improvement District work that's moving forward. So in time, I would hope that will provide added impetus to the leadership of the city centre as well. So I think surveys such as the one that we saw today, I don't know where that has come from necessarily, but I think we've got a really clear focus on what we want to do to improve the city centre and make it an even better place for people to visit.
Thank you, Steve.
Thank you very much. Councillor Wiggin, please.
Thank you, Chair. I've got a couple of questions on the city centre, looking at 14.2 in the report. The first one is about car parking, particularly with looking at people with disabilities. It says that Disability Peterborough have been consulted about city centre reopening. Looking at car parking, what plans are there for charging with car parks? They're currently free of charge. Are there plans to start charging again on council car parks? The reason for this is I've some constituents with blue badges have said they've been struggling to find spaces near to the city centre because of the free parking, where they would kind of places they would normally park are being taken up. So there's concerns about that. And secondly, to do with the shops and social distancing, because the shops are limiting capacity, there's queues outside shops. Some of these queues cause all sorts of problems. One example is Poundland in the city centre, where the queue has not always been managed well, so it can block the path. There aren't barriers in place to control the queue like there are in other places. Is that something that kind of thing you are looking at when you're working with stakeholders in these shops to ensure public safety, and that people aren't having to walk through queues to get to other places? Thank you.
Okay.
Yeah. Thank you, Councillor Wiggin. The intention is to keep the charges free for the time being. We'll keep it under review. We'll see how how July the 4th goes and the weeks that follow. It's important from the previous question actually about making the city an attractive place for people to want to come to. I'll certainly have a look at the disability or disabled spaces point. We have moved the ones behind the town hall along St Peter's Road to enable access in discussion with Disability Peterborough. But if there are some issues around sufficient disabled spaces, then we'll certainly take that away and have a look at it. And your third point, absolutely, working with retailers and now with from Saturday with restaurants and pubs to support them in ensuring the social distancing changes that will be coming in on Saturday to 1 metre plus. It's really important that we keep people safe, and we're working very closely with colleagues in public health to provide the advice and to make sure that the openings are safe.
Okay, thank you very much.
Chairman.
Councillor Marco Sereste.
Thank you, Chair. Can you hear me, everybody?
Can.
I wanted to go back for a second on the question of being an unhealthy high street. Obviously, I don't share that view, but but having said it, we are in the process of trying to reorganise and resettle the market. And one of the things that we're trying to achieve is to get certainly the fruit and vegetable vendors out into the Bridge Street, around the square, and we're talking to various people about farmers markets, and again to bring them into our high street rather than tucked away to the back of our city. So we are looking at stuff like that. As you very well know, not every fast food store is an unhealthy store. Some of the food even I enjoy, and we're encouraging them to come back out onto the street to make the whole city somewhere very inviting. We're looking at work to complement them if they do make the extra effort to come out with tables and chairs and parasols and gazebos onto the footpaths and onto the near the square. As you've probably noticed, we've already started replanting the planters. We're going to be you'll see very shortly the new hanging baskets, and we have now a plan to repair, upgrade and improve all the lighting in the city centre. And it's all down to money. Let's be frank, it's all down to money. We've got to get it all funded, but some of these things we have got funded, and some of these things we're looking for. But the whole priority is about doing work which will be long lasting. We don't want to go and do something that will be there for 3 or 4 months. We'll spend God knows how much on it, and then it becomes useless. So our view is whatever we need to do properly. We need to do it so it will attract more people into the city centre, and then it will be a long-term improvement to what we've already got.
Okay, thank you, Councillor Sereste. Councillor Bisbee.
Thank you. My question is to do with the licensing. Will the public houses and restaurants need to change licensing to be able to provide that cafe kind of lifestyle, using the streets, the pavements, the town centre? And if so, will that license continue until the license ends and be able to be renewed going forward?
Thank you. Who would take licensing, please?
Adrian, do you want to pick that one up? I know there are pavement licenses that have been introduced, but you're probably better placed.
Yeah, sure. Thank you, Steve, and through you, Chairman. So as Steve has mentioned, the spirit of the legislation is to encourage a cafe culture type recovery in our high streets, and the legislation very much supports the easing of bureaucracy to enable that to happen. So we've been working with around 70 premises in the city centre, engaging with all of them to find out what they want to do, and also what their current licence permits. And for some, it won't require a licence change at all. If they want to take outdoor space, they've probably already got that provision in their licence. For others, there will need to be a side licence issued. But as I say, the legislation has changed. It makes it far simpler. And I think, as Councillor Sereste was saying, and I think many of us share his vision, the idea of using our fantastic wide pavements and pedestrianised assets in the city centre really lend themselves to a cafe culture, and this is our opportunity to create that. So we will want to try and achieve permanency with the support of our traders, and encourage people to visit in a safe way.
Thank you, Adrian.
On that, if that's okay.
Yes, certainly.
I think it's a good idea, and when the weather allows, I think we should allow it to continue.
Okay, thank you very much. Okay, moving on then from city centre reopening, we're moving to 15, which is the recovery framework. Councillor Robinson.
Yes, thank you. So within section 15, it mentions action plans and recovery. So hopefully my question does suit this part of the report. It's a question for Steve, really, about the government cycling funding as part of the recovery efforts. I understand that there were rules around how tranche 1 of that funding was spent, but I feel we've had very little information on those spending decisions, and it's very hard for us to scrutinise it as a joint scrutiny committee. So I'm keen to see that we get some more information around tranche 2. But my question is particularly about, can you give any assurances or any hints already? I know it's not finalised yet in tranche 2, but will an effort be made to ensure that that cycling spending doesn't just go on the very immediate city centre? And the reason I ask this is that research shows that transport system planning, that's very much about getting people just into the very heart of the city, actually has a kind of discriminatory impact on women, because we don't all use transport in the same way. There's not universal usage between men, women, and particularly also young people. So yes, you know, can we have any reassurances that what we can look forward to in the tranche 2 spending or the combined authority spending on transport will see cycling developments outside more than just the city centre and particularly help young people?
Thank you. Steve?
Yeah, thanks, Chair. Yeah, thank you. You may know that the first tranche of funding and the gap between the guidance and the date for submission was literally, I think, 5 days. So I understand the frustration of not being able to input at that stage, but time was very tight. But I do want us, and we will, for the second tranche, which is more funding than the first. I think we're expecting between £700,000 and £800,000 from the second tranche for Peterborough. So if that's the case, you know, we need to broaden the opportunity for ideas to come forward. Once we get the guidance from government, we haven't got the guidance for the second tranche just yet, but as soon as we do, we want to consult with members clearly and other interested organisations around the city to see what those ideas are for the second tranche, and that is labelled as more permanent changes that are expected. That's what we understand the guidance will say. So it is important we get the guidance, we understand what it says, and then we get views. Timing wise, I imagine it'll be the next few weeks, but we'll have to wait and see. And I think just as a final comment on the first tranche, we were successful in getting an increase of 12% on the initial allocation because of the strength of the schemes that we put forward across Peterborough and Cambridgeshire. So if we then deliver as expected and required those schemes within the 8-week period, we'll then be well placed to do well and even better, hopefully, from the second tranche of funding.
Thank you very much for that. Councillor Coles.
Thank you, Chair. My interest is really in the recovery phase and under health and well-being. As you know, I've lost my partner to COVID-19. About 150 other people have, just in the hospitals. So it seems to be very much a shock to a number of people to have lost someone in very difficult circumstances, not being able really to hold any form of memorial, people living with the effect that you have possibly the remains of your loved one waiting to celebrate their lives, if you like. So I'm wondering what plans we have to memorialise the people who have suffered a loss of who have lost their lives, and for those families who've lost loved ones. Thank you.
Okay, thank you. Who will take that one?
Chairman, if I may just make a comment. Several weeks ago, actually now, we did receive some suggestions which did receive cross-party support to commemorate in some way, whenever the time feels appropriate to do so, the losses and those that have suffered in Peterborough. And that's very much something that we have absolutely committed to doing. We need to spend some time thinking carefully and sensitively about what that is, whether that's an event or a physical memorial. But please rest assured that is something that's very much in our thinking and our plans, and will be enacted at an appropriate time.
Okay. Thank you very much. Co-op D. June Ball, please.
Thank you, Mr. Chairman. On a brighter note, there have been some good upsides to the pandemic. I'm just wondering, therefore, how we are going to embed community volunteering and more agile working into business as normal post-pandemic.
Thank you. Adrian, would you like to take that?
Yes, thank you. Thanks, Councillor Bull. Yeah, the volunteer response has been completely overwhelming and humbling. We've recently surveyed the volunteers that have registered with us, around 2,500 across Cambridgeshire and Peterborough in total. And 60% of those volunteers have said that they would like to continue to volunteer after the pandemic ends, which is just incredible. About half of those people have a professional background of some kind and are DBS checked. So it's an incredible resource of richly skilled people who are just committed to doing good things for Peterborough and the rest of the county. So we're currently working with our 3 councils for voluntary service in Peterborough, that's PCVS, and other partners to establish a volunteer scheme which will include training and various roles and responsibilities. And post-COVID, we want to continue with many of the positive features that you've been describing just now, and supporting vulnerable residents generally in whatever normal times look like should be something we should just do. And with our army of volunteers support and help, we think we can make a real and lasting difference. So very much front and centre of our thinking, and we're hugely grateful to them for all they've done so far.
More agile working into business as usual.
I wonder if that's a question for Sue or for Amanda.
Well, I'm happy to answer that, Chairman, actually.
Yes, please.
One of the really interesting, I think, upsides of COVID-19 is it's changed the face in which organisations work, and it's not just the council. In terms of the work that we're doing, we've surveyed all of our staff, so we've got some really good feedback from them about how they want to work in the future. And agile working and home working will be absolutely a feature of the future. My attitude towards it is that we've got a great set of staff. They've absolutely risen to the challenge during the course of COVID-19. They've demonstrated that they can both work from home, but also that those at the front line, they can work effectively on the front line. And my attitude is we've got, as officers, a series of outcomes to deliver, and provided we do that, I'm not much fussed about where that's done. And I think, we've got to trust our staff. We've trusted them to do some fantastic, and we need to continue to trust them. And home working and a blend of coming into the office will be very much a part of the future. So whether you are working from home or whether you're working on the front line, we are going to still continue to deliver great outcomes as we've done so far.
Thank you very much, Gillian. I'm conscious of the time, everybody. Obviously, we've gone over the 2 hours, but obviously it's a very, very big subject, and I appreciate you've got questions to go. But could I ask you to keep them as brief as possible and the answers as brief as possible as well as we continue? Thank you. So we're going to 16 now, Vivacity. I've got Councillor Quine, please.
Thank you very much, Chair. I have 2 questions. I'll keep them brief. Thank you. First of all, what is happening with the TUPE of 500 staff, 97% of whom live in Peterborough or the Greater Peterborough area, after Vivacity handed the contract back on the 18th of June? My first question, please. And my second question is pertaining to bullet point 16.2. When will Peterborough's libraries, museum and art gallery open up, as Fenland District Council have already opened up their libraries? Thank you.
Which officer is going to take that?
I'll take that, Chair, if that's okay.
Yep,
Amanda.
thank you, Amanda.
Good evening, everyone. Firstly, on your point about TUPE, we are working very closely with Vivacity during this 90-day period, and we've got the first information from them just this week. So we've now seen all of their HR data, and we're just working through that. We have a few questions, and we are committed to working with them quickly on that. So we'll have an answer on TUPE within the next 2 weeks, but it's too early to tell because we're just beginning to get the data requests. back from Vivacity. There's a huge amount of information in there. A lot of the staff are still furloughed, so we just need to work through the detail. But we are very closely looking at the workforce in Vivacity, and we're very aware that there's anxiety and interest in the future, and that many of them are residents of Peterborough. So we're handling that very carefully and as quickly as we can. On the second one about libraries, I'll hand over to Adrian to answer that one. Thank you.
Thank you, Amanda. Yeah, so I share your desire to get libraries open as quickly as possible. And as I mentioned earlier, I'm meeting the operations director and the chief executive of Vivacity tomorrow to find out if they have any reopening plans in mind. I'm also responsible for Cambridgeshire libraries, and you mentioned those in the Fenland area. They're within my service area, and they actually open in part from Monday. And so we've got some learning there that if we need to, we can share with Vivacity. I'll just remind everybody that they do remain responsible for their services until the 90-day transition period has ended. So we want to work with them, as Amanda said, to ensure a safe and appropriate opening of services, particularly libraries. You mentioned other services as well, and the same goes for those. So I'm hoping that towards the end of July, if not before, we should have a very clear opening plan that we can share with you that has been well thought through and is affordable and deliverable.
Thank you, Adrian, and thank you, Amanda.
Thank you, Adrian. Okay, Councillor Ellis, please.
Thank you, Chair. Given all the concerns about all the Vivacity services, ranging from libraries, sports centres, water parks, etc. Now there is government money available for things for COVID-19. Will the council be bidding for some special funding because of COVID-19 in relation to what's happened with Vivacity? They've had 2 grants already, amounting to 11 million, but is there an opportunity, and will the council be looking for some extra money to help us on this?
Adrian, will that be back to you?
I wonder if it's a question for Pete, actually.
Yeah, I'll take this
Thanks,
one.
Pete.
It's quite interesting, if that's all right, Chairman.
Yeah, of course.
In terms of grant funding, we can only apply, and the Secretary of State actually made it quite clear this afternoon, if we run the services for leisure. There's quite a groundswell across councils at the moment to try and get funding for leisure in particular. That needs to come from the Department of Culture, Media, Leisure and Sport. In terms of MHCLG, we can only start looking at that when services transfer back to us. And that was made quite clear to us this afternoon in a question.
Thank you. Councillor Skipstead.
Thank you, Chair. I have a question regarding 16.2, the statement which talks about plans for Vivacity will take account of how people's lives have changed, e.g. the increased use of local open space, people valuing using facilities which are more local to them in order to reduce non-essential travel. I wonder what that meant in real terms, because, for example, people have stopped swimming because there are no swimming pools open, but it doesn't mean they don't want to go back to swimming in swimming pools afterwards. So I want to know, are the council planning to cut back on the leisure offer to residents? Because it kind of sounds like it. So I wanted to get that clarified. Thank you.
Okay, thank you. Adrian?
Do you want me to take that one initially?
Yes, please.
Yeah, so obviously the way forward must be affordable, and we need to understand the information and data and intelligence that Amanda has already described us as receiving, and that's the information that we are making our way through over the next couple of weeks. The intent in paragraph 16.2 was that, although I've just said that, not in any way to imply that services will reduce. It's really important that I stress that, unless or until they are seen to be unaffordable, or that the demand for those services has significantly shifted. Instead, what that paragraph is trying to illustrate is that we recognise that things will be very different as recovery takes place, and we think community recovery will take a significant amount of time. And what we want to try and do is to work with our residents, with our elected councillors, with the many clubs and societies and groups that make use of Vivacity's facilities to ensure that our offer is absolutely in keeping with the new way that people will want to live their lives. So the example of using parks and open spaces and providing more facilities such as outdoor gyms, more tennis courts, more cricket pitches, as an additional potentially offer alongside gyms for those people that want to continue to benefit from an indoor gym facility is very much the spirit of what that paragraph is trying to describe. I hope that's helpful and gives you some confidence.
Thank you. Thank you very much. Councillor Joseph, please.
Thank you, Chair. I would just like to ask the leader and obviously those involved in the Vivacity work that they give full assurances that all aspects of Vivacity will be looked into and all options in regards to bringing services in-house will be explored to the fullest.
Adrian, please.
Sorry, Chairman, just taking myself off mute. Yes, absolutely a guarantee that that is the case. So we are line by line, service by service and building by building, looking at every aspect of current provision. And we are very, very open-minded about what alternative ways of delivering these services looks like. And that will include, of course, looking at what services might be best delivered in-house. So again, we'll keep members very well briefed on this. It's still way too early to say, as Amanda said, what it will look like, but all of those options, including in-house delivery, are very much in our thoughts and considerations.
Thank you. Councillor Wiggin, please.
Thank you, Chair. Yeah, on the same point from 16.2 about local facilities, will you be looking at working with community partners such as parish councils and other community groups to help look at that offer and whether local groups and parish councils could be more involved in the running of the services, and also linking them together with other community assets? I know I've been talking to Adrian recently about the community centre and community room in Hampton and how they fit into the overall package for community groups and for facilities.
Thank you, Councillor. Yeah, it's a categorical yes, an absolute yes. And this is our chance to, our mantra at the moment, you know, should be local is best. Let's get things happening within the heart of a community. This is a real opportunity to reset some of those arrangements within small communities where we might be able to cluster together services and functions to make them even more viable and vibrant than they already are. So an absolute guarantee that that is exactly our approach.
Okay, thank you very much. Councillor Casey.
Thank you, Chair. Sorry for all my camera flying around a couple of minutes ago. I was trying to reconnect. Actually, one of the things that people will know that I'm really passionate about, the fact that actually culture has a huge role to play in any recovery that we've got. And my question was going to be in the previous one about why culture isn't actually one of the 6. But in this one, I'd really like to get a reassurance or an assurance that that it's an ambitious plan to use culture and creativity to recover from this COVID situation.
Okay, thank you.
Thank you, Councillor Casey. Again, it's a categorical assurance on my part. Gillian and I met yesterday morning with the Arts Council's Chief Executive to discuss our thoughts and aspirations for the city, and very much that conversation was centred on using the arts and culture and heritage within our city, and that we need to grow in order to achieve a strong recovery. And in various other discussions that have been held, Cabinet and full council and various other forums, we've talked confidently in the past about the role of culture and how we need to really grow it. I think we're all tired of being described as a cultural cold spot, which very much is not the case, but we do need to build and expose some of our cultural assets much more. I'm really pleased to confirm that the work that we'd started before the lockdown to develop a new cultural strategy for Peterborough will continue. It's on hold pending the lockdown being eased, because clearly we need to engage with performance artists and companies and others. But that work will continue again, hopefully in the autumn, and that will be a highly ambitious and aspirational culture strategy, which will make the most of our existing cultural offer, but also maximise that offer even further. Front and centre again of our recovery plans.
I think I'd really just like to emphasise, I've been to a couple of Zoom meetings, and these have been sort of music Zoom meetings, but one of the things that's come up a few times was a workshop on how to apply for universal credit. So I cannot stress how important it is for the industry and the entertainment industry going forward. We hear a lot from other industries, sort of with their begging bowls out, but actually, I think as far as culture is concerned, it is of paramount importance.
Thank you, Councillor Casey. Thank you, Adrian. Okay. I've got Councillor Simons.
Yeah, just a question for Adrian. I mean, as disappointing it is about Vivacity, can we use this? Do you see this as a positive opportunity to, like you say, share services and make it even, more positive with this, with the after COVID?
Did you get that, Adrian? I want to get it repeated.
I did, thank you, Councillor.
Okay, good.
Yeah, so yes, we're all hugely disappointed with and very sad about the outcome that we find ourselves in at the moment. But inevitably, with every negative situation, there must come something positive. And actually, we do see there is a real opportunity here to review the suite of services that Vivacity are currently responsible for. Our thinking is at the moment that we might group services together into various categories and to develop almost a mini vision for each one of those categories. So heritage, arts, libraries, leisure, and so on, and actually reset our own local vision for those services, rather than trying to take the range of services in the whole and in the round. And therefore, absolutely, Councillor, this is an opportunity to really ensure that those services are meeting the modern needs of our city. The contract is 10 years old now. We need to make sure it's still current, and this is an opportunity to do that. And we will, I imagine, see various different arrangements emerging based on those groupings. And we'll bring our thinking through the political process in the normal way, of course, and we've got the 90 days to do this in, and it's likely we'll need some interim solutions, but we are thinking ambitiously and thinking of this as an opportunity in what are very difficult circumstances.
Adrian, okay, I'm going to move through these by number now. Just if you'd like to put your hand up if you want to ask a question on it. Risk management 17. 18, alignment with corporate priorities. 19 is consultation. I'm sure everything on that. Anticipated outcomes is number 20. 21 is the obvious reason. 22, alternative options considered. 23, which relates to implications. Co-opted June Ball, please.
Thank you, Mr. Chairman. Can I ask about the forecast that we currently see, where the deficit gap for the upcoming year is getting wider and it isn't yet taking account of central government, extra central government funding for COVID-19? And also that gap seems to be enlarging from certainly not only 21-22, but 22-23. So if we are predicating our forecasts on getting lump sum grants from central government and then we don't get them, how bad is our funding? Bearing in mind we've used up most of our reserves.
Peter, I think that's yours.
Yeah, thank you. I think the whole sector is almost in the same position. There was a speech this afternoon in the LGA conference where the Secretary of State spelt out additional funding. The reason the numbers go up month on month is because our data becomes better and better. The data for April we were in the first month and a half, we go through May, and we get more and more defined. Also, more and more things we've found we've had to do as well. And more things maybe we haven't got in terms of income and other things. So that's quite clear. I think this is a sector-wide issue. It's just not Peterborough. And through the LGA, through our professional associations, we're all lobbying central government, who MHCLG, and as I've said, other departments that fund council services, are now in a negotiation with Treasury to see how much money we can be delivered. A lot is going to depend. There's a budget next week. We might get some inklings then. But again, what the financial settlement will be going forward, because the vast majority of councils will be in a similar boat. The biggest thing in here, which isn't on that table, is lost tax income and how we deal with that, which is even far bigger than that number.
Can I come back with a supplementary? Talking about,
you can, but can you do it briefly, please? Because we're
quickly, talking about council tax and business rates not coming in. Surely, as you rightly say, it's a universal problem and it has to be fixed. Otherwise, we'll be Northampton all over again, or Northamptonshire Council all over again.
It's thank you, Chair. It's a countrywide issue, and at the moment, as of today, the government have put the Department of MHCLG have put together a plan to look at reducing or looking at our collection fund deficit over a 3-year period. However, there was a rider on it to say we will look towards the end of this calendar year, when we do the local government settlement for next year, to look at the allocation between central government and local government in terms of those losses.
Thank you, Pete. Okay, I have Councillor Joseph next.
Obviously, with the provision for homelessness and looking after them within the hotels, presumably the government had a certain budget, etc., for that particular provision. And I would assume that that would include some cost towards food for the people within the hotels. Given that across Peterborough, that has been taken up by many people who've provided those meals for them, both lunch and evening meals, on a daily basis, and therefore the council hasn't had to do that. Has any of that funding been applied for, and if so, what has it been used for?
Thank you, Councillor Joseph. In overall terms, as Mo had said earlier on, the actual sum of the homelessness grant across country isn't particularly large when you look at the overall expenditure. And so as part of these figures, I've had to include the additional costs to us at the moment. We are applying for an allocation through the grant process tomorrow, but we will not get anywhere near the amount of money we've been paying out. And so that goes into the overall MHCLG claim.
Okay, thank you very much. And the final question is Councillor Himraj, please.
Able to put a recommendation in this bit during the finance bit?
No, do it at the end, if you would, please.
Yeah.
Okay, thank you very much. Okay, I've got no more on that one then, no more hands up have come up on mine. So we'll just go through the last 2 bits. I think they're all, unless anybody's got anything particular on the last sections, they're all just explanations. No? Okay, fine. Thank you very much. Okay, if there's no more questions, I'd like to note the recommendation in the report, which is for the Joint Scrutiny Commission to note and comment on the progress made to date in responding to the impact of the coronavirus. I believe we've done this, and unless there are any objections, we will accept this recommendation. If there are any objections, would you like to raise your hand now? No, I believe then we have some recommendations. If you'd like to raise your hand to nominate or suggest a recommendation. Okay, Councillor Joseph, you're first, please.
Yeah, just following up on my conversation with Jonathan about period poverty, I would like to recommend that we look into that, and a report comes back to us on how we're going to deal with it in schools and with the reduced timetable of schools and during the holidays, please.
Thank you. Jonathan, do you understand what's been asked of you?
Yeah, no worries. Happy to do that.
Okay, fine. And we need a seconder, please, Councillor Joseph. Somebody just come in and say.
I can do that.
Councillor Skipstead's a seconder then. Are there any objections to that? No. Okay, so that one is, the recommendation is agreed. So that's the first one. Councillor Hemraj, please.
Going back to my PPE, can I recommend to explore a feasibility study as drawn up on purchasing of PPE, joining up with care homes and care agencies in a joint venture with the purchase of PPE to ensure economies of scale? In other words, the more you buy, the cheaper it is.
Wendy, I think you're answering on that one. Is that something you could do? I've lost Wendy.
I'm certainly happy to look into it. What I would say is we wouldn't at this moment in time want to put lots and lots of effort into doing a big feasibility study. Not being funny, we are making sure the care homes do get as good a deals as they can. So I think we have considered it. So I'm happy to pick it up with you outside the meeting, but I feel a bit uncomfortable with it being a recommendation because we don't want to actually be putting lots of effort into that when actually we're trying to support the care homes on the ground.
Okay, Councillor Hemraj, are you happy with that? Yeah, okay, we'll leave that one at that then.
Thank you.
Thank you. Councillor Robinson.
Yes, thank you. Mine's with school transport issue in mind, as someone raised earlier about the risk of lots of cars now outside schools, and trying to mitigate a little our school children squashed onto buses and taxis. So I'd like to recommend that the Directorates of probably Place and Economy and Education explore the options and feasibility plus the cost of a kind of bike to school scheme, and report that information to a scrutiny committee and hopefully place it for consideration by a decision maker. Bike to school scheme, just to elaborate, would cover support for schools around infrastructure like bike storage, looking to get bikes for those who have funded council transport, which hopefully then might save us some money as well on that budget, and even looking at the cost of a grant scheme for bikes on those on free school meals, because after all we can't have a school streets project if kids can't afford bikes. So yeah, I've raised it with the directors and they thought it potentially had legs to explore. So
thank you. Steve, is that something you'd be happy with?
That's fine, Chair. It's one option actually to look at for the active travel funding, but we'll certainly have a look at it anyway.
Okay, so I need a seconder for that.
I'll second it.
Who was that?
Councillor
Ellis. Ellis, yes. Thank you very much. Any objection to that at all? Anybody? Any objections? No. Okay, fine. Fair enough.
Sorry,
we'll move on from that then.
Sorry, Chair, could I just interrupt one? Could Councillor Robinson just summarise the recommendation again, because it was a bit
it broke up.
Yes, thank you.
Could you summarise it then, please?
Quickly summarise it, please. Thank you.
Yeah. So the Director of Place and Economy and or the feasibility and costs of a bike to school scheme, and report that information to a scrutiny committee and place it for consideration with the relevant decision maker.
Did you get it this time, Paulina? Yeah.
Yes, thank you very much.
And we have the second of Councillor Ellis, so we're okay with that. No, there's no objections, so I'm happy with that. Councillor Bull, sorry, co-optee June Bull, should I say?
But you drop back into the past. Look at the, you asked me to come back at this recommendation. It's looking at the care home deaths of 140 for Cambridgeshire and Peterborough local authority area from the 15th of April to date, compared to the national average or the neighbouring counties. And I think Dr. Liz Robin was going to come back to me on it, and or another one of her colleagues.
Did you want it as a recommendation then, or just directly to you?
Sorry, that's more of an action, Chair, not a recommendation.
Yeah, so that's an action, yes?
Okay.
Yeah, okay. Everybody happy with that? Or should I say any issues, any objections to that? No, that's fine. I've got no others on the, no other hands have come up, no, so that's great. Thank you very much. Okay, great. So finally, before closing the meeting, I'd like to thank Gillian and her team for all their hard work in providing support, care, information and advice in these unprecedented times to the people of Peterborough, to us as councillors and to all the council staff. It is very much appreciated and recognised that these are unprecedented times and very difficult, and that staff are working around the clock to ensure services are delivered in the best possible way. Therefore, I will now close the meeting and thank to you, everybody who's in attendance today. Thank you to all the members, the general public and the press for joining us, and please stay well and have a good evening.